Hi, my name is Raj Kamal. I'm a student of nursing from University of Western Sydney. Today, I'm going to present on the topic health promotion for the prevention of cardiovascular diseases in Aboriginal and Torres Strait Islanders in remote areas. Firstly, I would like to introduce the members of our group. We are four members in our group: Hardeep, Sammy, Sejan, and myself. Based on the assessment requirements of the unit Aboriginal and Torres Strait Islanders Health, we are presenting on the role of health promotion principles to prevent cardiovascular diseases in remote communities of Aboriginal and Torres Strait Islanders. This presentation is based on three main aims and objectives. First is the link between culture and Aboriginal and Torres Strait Islanders health. Second is the social determinants of health that impact cardiovascular health. Third, the critical analysis of the culturally competent and safe nursing care to promote cardiac health of remote communities of Aboriginal and Torres Strait Islanders. So, my another group member Hardeep will gonna present on the link between culture and Aboriginal and Torres Strait Islanders health and social determinants of their health. And I will discuss culturally competent and safe nursing and midwifery practice in relation to health promotion for cardiovascular disease in remote areas. Before talking about the links between culture and Aboriginal and Torres Strait Islanders health, she will discuss about the geographical location of remote community of Aboriginal and Torres Strait Islander and their cardiovascular health status. She will also describe briefly about the health promotion principles which can be used to prevent cardiovascular problems in this community.
As regarding to the demographical characteristics of the Aboriginal and Torres Strait Islanders peoples in remote areas, I would like to say that 2.8% of Australian population accounts for Aboriginal and Torres Strait Islanders. Out of that, 90% are Aboriginal, 6% are Torres Strait Islanders, and 4% are both Aboriginal and Torres Strait Islanders. According to Australian Institute of Health and Welfare 2014, 7.7% of Aboriginal and Torres Strait Islander lives in remote areas as compared to that of non-Aboriginal and Torres Strait Islanders, which is 1.7%. Moreover, Aboriginal and Torres Strait Islanders make 16% of the Australian population of remote areas and 25% of Northern Territory, which is situated in central northern regions of Australia. The map and the table in this PowerPoint presentation shows the remote communities of Aboriginal and Torres Strait Islanders in the top west end of the Northern Territory and Valley community having the highest population of Aboriginal and Torres Strait Islanders as compared to other communities. This evidence suggests that most of the Aboriginal and Torres Strait Islanders population resides in remote areas of Northern Territory. As far as the cardiovascular diseases are concerned, stroke and ischemic heart diseases are higher in remote areas than that of cities and regional areas in all over Australia. Based on the statistics provided by Australian Health Ministry Advisory Council 2015, the proportion was 5.9%, 4.6%, and 5.6% respectively. However, in Northern Territory, highest mortality rate was recorded due to coronary heart disease, and rheumatic heart diseases are the highest contributing factor for mortality in remote areas of Northern Territory. This graph represents the varying trend of new registered cases of rheumatic heart diseases in top west end of Northern Territory. This evidence shows that in comparison to Central and Northern Territory, the Aboriginal and Torres Strait Islanders living in top west end of the Northern Territory suffers more from rheumatic heart diseases, although from 2009 to 2013 the proportion of rheumatic heart diseases followed a downward trend. As discussed in the above slides that the rate of cardiovascular diseases is higher in Aboriginal and Torres Strait Islanders living in remote areas, there are various factors that have contributed toward increasing rate of heart diseases. One of the main factors that have shown the strong link with Aboriginal and Torres Strait Islanders' health status is culture. The cultural beliefs of Aboriginal and Torres Strait Islanders form an important part of the connection with their health. The Aboriginal and Torres Strait Islanders show the connection to their country as one of the important parts of their health and well-being. It depicts that Aboriginal and Torres Strait Islanders link their health situation with their family disconnection. One of the studies highlights that many Aboriginal and Torres Strait Islanders have shown an evidence of not involving in health interventions due to their cultural beliefs. The social support in Aboriginal and Torres Strait Islander communities is also one of the important concepts in health and cultural beliefs of the Aboriginal and Torres Strait Islanders. To explain further, this concept demonstrates that involvement of family and friends and community networks can reduce their isolation, which can indirectly impact their physical health because they can share their problems with their family members, and this also helps to reduce disease burden. On the other hand, if they don't have social support and communication with friends, family, and healthcare professionals, and no another supporting groups, all these factors can lead to depression, which are responsible for cardiac disease burden. Simultaneously, the cultural beliefs of Aboriginal and Torres Strait Islanders have shown negative impacts. For instance, they prefer to visit healthcare centers in very critical situations because of misinterest in health services which could deteriorate their health. Except from culture, there are some other factors as well which can impact the health of Aboriginal and Torres Strait Islanders. These factors are known as social determinants of health. Social determinants are the conditions in which the people are born, grow, work, live and age according to World Health Organization 2017. These fundamental social determinants are education, access to health services, access to food, socioeconomic status, education and employment status of the people living in remote areas. As regarding to the education attainment and socioeconomic status, Aboriginal and Torres Strait Islanders in Northern Territory accounts for 4.3% of tertiary education and $1,225 weekly household income, which shows that Aboriginal and Torres Strait Islanders are more disadvantaged than non-Aboriginal and Torres Strait Islanders peoples in terms of low level of household income, education and employment status. This gap in education attainment, employment, overcrowding contributes for 31% more cardiac diseases in Aboriginal people than non-Aboriginal peoples. As far as access to health services in remote areas is concerned, it is far behind as compared to that of urban and regional areas. According to Australian Institute of Health and Welfare 2014, in remote areas, average access index to the general health practitioners is 7, which is 9 in urban areas. The reason behind this is the travel time and competition from other populations using same GPs in that area, which can impact their consultation fees. So it can be said that the Aboriginal and Torres Strait Islander peoples living in remote areas who have low socioeconomic status cannot afford these services, which can impact their cardiovascular disease burden. Thirdly, adequate food availability such as fruits and vegetables are an important part of our meal. These food options are difficult to access in remote areas, which can adversely impact their physical health. Moreover, these eating habits are also linked to obesity and overweight in Aboriginal and Torres Strait Islanders, which could increase the risk of chronic obstructive pulmonary disease, stroke, and coronary heart disease. Therefore, improvement of lives of the Aboriginal and Torres Strait Islanders, especially in remote areas, is the priority. Because the proportion of cardiac diseases is higher in Aboriginal and Torres Strait Islanders living in remote areas than that of living in metropolitan areas, as well as the non-Aboriginal population. As regarding to the transport facilities in urban areas, there are few private and public transport facilities available in Northern Territory, and 5 major roads are sealed because of flooding and other weather conditions. Apart from that, access to health services, employment and education opportunities are limited because of this lack of infrastructure development, according to Transport and Infrastructure Council 2015. People living in remote areas don't have access to public or private vehicles, as annual travel expenses are $4,000 to $7,000 higher for the population living in remote areas than that of urban areas, which is expanding socioeconomic exclusion for this population group. This can be the reason why people are not using health services for treatment of cardiovascular diseases, according to Australian Institute of Health and Welfare 2014. To prevent cardiovascular diseases, health promotion is chosen as a healthcare need in Aboriginal and Torres Strait Islanders, which can be defined as a process of enabling people to increase control over the determinants of health and thereby improve their health, according to World Health Organization 2018. Various health promotion principles have been adopted by Ottawa Charter that have considered various cultural, social, and economic factors. These are building healthy public policy, creating sporting environments, strengthening community actions, developing personal skills, and reorienting health services. Firstly, developing healthy public policy means coordinated actions of the people and the community to foster equality in terms of income, safety, health, and other services. Creating sporting environments means the evaluation of rapidly changing environments such as work, health sector, infrastructure, living conditions, and modify them to ensure positive impacts on the health of the public. Strengthening community actions can be defined as the empowerment of residents of the community to set priorities and involve in decision making, implementation, and evaluation of these priorities to achieve better health outcomes. Develop personal skills means enabling the people to make better decisions and cope with the chronic conditions through providing information and education for health and other life skills. Reorienting health services deals with the participation of individuals, healthcare services professionals, government and community members to promote health and well-being. The implementation of these principles in health promotion programs would be beneficial for Aboriginal and Torres Strait Islanders to improve their cardiac health through public health policies on diet, physical activity, smoking, sanitation, and drug use. The following video that is taken from Rheumatic Heart Disease Australia will also describe the importance of knowledge about these mentioned factors for healthy heart in the children of Vedic community. To reduce cardiovascular disease burden and the incident rate of cardiovascular diseases, the health promotion programs targeting CVDs are already initiated in remote Aboriginal and Torres Strait Islander communities. These health promotion programs are McCain's a Move Physical Activity and Nutrition Program, which is based on physical activity and the improvement of nutrition. Lula's Health Check Child Health Activity, Fruit Share, and 3 Healthy Messes programs for youth. All programs are based on the ecological model of health promotion, which could address the individual and environmental determinants of health.
In order to address health promotion need for Aboriginal and Torres Strait Islander individuals or communities who experience cardiovascular diseases in remote areas, nurses must make sure they provide care that is culturally competent and safe. Culturally competent and safe nursing care is the ability of the healthcare professionals to provide care to the patients by keeping diverse cultural beliefs and behaviors in mind and meeting their social, cultural, and spiritual needs. Hence, nurses should give importance to their family and country because these people relate connectiveness to the country to their health status. Hence, nurses should analyze the health problems by having full understanding and knowledge about the impacts of lifestyle and customs of the Aboriginal peoples to ensure their safety. Furthermore, it is hard to understand the problems of Aboriginal and Torres Strait Islanders if the nurses is not from the same culture background. In these situations, nurses should work in partnership with the other healthcare professionals so that the deep understandings of the social, physical, cultural, and spiritual needs can be achieved. Most of all, the Aboriginal and Torres Strait Islanders speak English as their second language. So, to make any health promotion program successful and accessible to them, the use of simple language is highly required, and if possible, the use of interpreter in their own language can be useful. As regarding to the video shown regarding healthy heart in previous slides, the use of native language of Vaidahic community is valuable to teach the children about their cardiac health. Apart from that, nurses should be competent in the use of verbal and non-verbal skills to communicate with the patients to get their trust in health promotion interventions and have the ability that influence the individual communities, groups, systems to make these health promotion programs successful. To do so, nurses should work in collaboration with the policymakers, local primary health organizations, and families within the community because these people believe in social support from communities, families, and friends. Furthermore, evidence based practice, which is systematically tested and clinically proven, should be used. Nurses should take all social determinants such as poor housing, diet, physical activity, smoking, unemployment, illiteracy, use of health services, knowledge, and access to health services into consideration to provide patient centered care. These are some of the fundamental concepts of culturally competent and safe nursing practice, and the health promotion programs which are based on these guidelines would be able to promote the health and well-being of the Aboriginal and Torres Strait Islanders by establishing a good rapport with the client.
From the aforementioned information, it can be concluded that most of the Aboriginal and Torres Strait Islanders of Northern Territory lives in remote areas. The Aboriginal and Torres Strait Islanders living in remote areas have higher incidence rate of cardiovascular diseases. The main reason of this increased cardiovascular disease burden could be their cultural beliefs and other social and environmental factors. Regarding to the link between culture and Aboriginal and Torres Strait Islanders' health, both positive and negative impacts have been evaluated. Apart from culture, various social determinants of health such as lack of education, healthcare facilities, healthy food options, and transport facilities have affected health of Aboriginal and Torres Strait Islanders. The initiatives of adopting Health promotion principles and various interventions would be beneficial, followed by evaluating various social determinants of health that can help to reduce the burden of cardiovascular diseases in Aboriginal and Torres Strait Islanders living in remote areas. To make these interventions successful, culturally competent and safe nursing practice should be incorporated, which includes adoption of professional communication skills, partnership with other healthcare professionals, communication with other healthcare professionals which are from same background of the Aboriginal and Torres Strait Islanders people, and respecting their cultural, spiritual and social beliefs. This slide and next slide have some important articles which we have used for making this presentation. If anyone would like to know more about this presentation and about Aboriginal and Torres Strait Islander people's cardiac health, then they can search for these articles on university website or any another academic website. Thank you.